Hello and welcome to Bite-Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organisations, and the material covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Takayasu's arthritis under the section of rheumatology. So, what is Takayasu's arthritis? It's a type of large vessel vasculitis and is also known as pulseless disease. If you want a refresher of an overview of how we classify different types of vasculitides, please feel free to refer to our video library, and that's one of the topics that we have covered in one of our previous episodes. In terms of epidemiology of Takayasu's arthritis, it's predominantly a disease of young females, and in fact the female to male ratio is 8:1. The median age of the disease is 25 years old, and also it's most common in Asian populations, including Japanese, Chinese, Indian and Southeast Asians. Symptoms of it is really quite varied and depending on the individual. However, as an overall perspective, it can very frequently present with hypertension, and in a young female who's presenting with persistent hypertension is certainly one of the differentials that you need to be thinking about. It could present with arthralgia, headache, which could be as a result of vasculitis itself, or it could be as a result of hypertension. It could present with cardiac involvement, and that's in the type of angina or even presyncope or syncope. Your examination findings, really you want to be, again, like any other disease, to be systematic in your approach. And that is to say that you would, of course, after taking a full history, you would be wanting to examine the patients. In your examination, you'll particularly be interested in picking up bruits, which may be in any regions from carotid to abdominal. The patient could have asymmetric pulses or decreased pulses, so they may be complaining about, for instance, feeling of cold in the hands or in the toes, or pain, and you might also pick up radial or radiofemoral delay on examination. Going hand in hand with that, patient could be having asymmetric blood pressures, and also in about 30% of cases it will be involving the ophthalmic branch and artery, which will result in visual disturbance. As for its investigation, again, starting from bedside, you would want to do blood pressure, and this is something that you really want to be taking in all 4 limbs to look for any evidence of discrepancies, and in any reading that has a greater difference of more than 10 millimeter mercury, we would be interested in that. You would want to check for any evidence of hematuria on your urine dipstick. You would want to do a thorough cardiorespiratory examinations, listening for murmurs and bruits. You of course would want an ECG. Bear in mind, as I mentioned earlier, one of the commonest features that this patient presents is in the case of angina or MIs, so you would want to be looking for any evidence of acute coronary syndrome or left ventricular hypertrophy as a result of chronic uncontrolled high blood pressure. You would want to have a chest x-ray, and that's really something that you should be doing for anyone who's presenting with a case of chest pain or angina. In terms of the imaging modality of choice, the preferred one is an MR angiogram. However, other types of imaging is also used. These include CT angio and also PET CT as type of nuclear medicine. And if all of these investigations in terms of the imaging have come inconclusive or are unavailable, then you would be considering the patient for a possibility of invasive angiography. As for your blood tests that you would want, and just some of the reasoning of why you want to be asking for this blood test, because especially in the case of cases of PACEs, you need to be able to reason about why you want a specific test. So you would want to check for check full blood count, and that's to check for any evidence of anemia of chronic diseases. You want to check for renal function, and that would be to check for acute kidney injury or AKI due to renal hemorrhage. You want to be checking for ESR and CRP, and these are really quite non-specific in the case of Takayasu, and it could even be normal in about 50% of cases. And importantly, biopsy or tissue biopsy rather is not necessary to establish diagnosis in here, and you really should be trying to get your diagnosis with the help of history examination, your basic bedside investigation such as urine dip, as well as your MRA or other imaging modalities that we talked about. Treatment of it is that it requires normally a combination of corticosteroid and other forms of immunosuppressants, and up to 70% of cases will need arterial reconstruction or bypass. The in-depth treatment of this is, from our perspective, is quite unlikely to be expected from an internal medicine trainee who's trying to sit MRCP examination. However, if you're particularly interested in this, by all means do feel free to go and spend more time trying to learn about the details of this treatment and the different immunosuppressants that are available for this. Okay, let's do some questions. Which of the following is the preferred imaging modality to diagnose Takayasu arthritis? 1. PET CT, 2. CTA, 3. MRA, 4. chest x-ray, 5. echocardiogram. And if you recall, the preferred modality is in fact an MRA. However, a lot of the others, such as PET CT and CTA, are very frequently used to help with the diagnosis of Takayasu arthritis, and chest x-ray and echocardiogram are also two of the reasonable differentials that you probably would be getting before having any nuclear imaging on the patient who's presenting with chest pain. Thank you for listening to this episode of Bite-Size MRCP. If you like the sound of what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.